Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Gombe State increases coronavirus testing capacity, establishes molecular diagnostic lab at Gombe Specialist Hospital. Ahead of the resumption of international flights, we get the level of preparations from the Director General NCAA, Captain Musa Nuhu. And Spain to use 2,000 soldiers trained in tracking to help identify people exposed to the coronavirus. Total coronavirus cases on admission in Nigeria was down by 458 cases. This is after the Nigeria Center for Disease Control, NCDC, announced 252 new cases yesterday. The new cases are reported from 17 states and the Federal Capital Territory. Total active cases now stands at 11,829 from its 12,287 as at August the 25th. Following the discharge of 707 persons, one of its highest in 24 hours. 3 deaths were also confirmed from the center, 2 recorded in the Federal Capital Territory and 1 death in Taraba State. While the states continue to ramp up testing, only 3,588 samples were recorded as at 12 midnight the previous day, putting the total number of COVID-19 tests done nationwide at 383,130. Till date, 52,800 cases have been confirmed, 39,964 cases have been discharged, and 1,007 deaths have been recorded in the 36 states and the Federal Capital Territory. Now, Governor Inua Yahya of Gombe State has commissioned a molecular diagnostic laboratory at the Gombe Specialist Hospital to solidify the state's base in the fight against COVID-19. It's a multi-million naira state-funded facility, according to the governor, is a testimony of the state's commitment to fighting the deadly virus.
This is a PCR workstation. The role it plays is basically to ensure that there is no contamination. We have this.
In the meantime, a representative from the NCDC says the state-of-the-art molecular diagnostic facility meets international standards, refers to it as the holy grail of testing machines internationally because of its precision and versatility to diagnose other deadly diseases such as Lassa fever and a host of other viral infections. Now let's go over to Kaduna as the senior secondary certificate examination gets underway in the state. Many schools there, they've set up isolation rooms within the school premises where students who show any symptoms of COVID-19 will be evacuated to continue with their exams. This is to ensure that such a student whose health is affected does not in any way infect others. This year's senior secondary school certificate examination is a very different experience for students and teachers. The government says it is mindful of the dangers of COVID-19 and has distributed free face masks, infrared thermometers, hand wash basins to all schools across the state before the commencement of the examination. Now, a face mask is considered one of the effective ways to protect oneself from contracting COVID-19, but it appears some students writing both the senior school and basic education certificate examinations in Niger State are not comfortable using the mask. They say it's really difficult to breathe with their masks on, an experience which they see as a distraction during their exams. Here's more with our correspondent, Emperor Simon.
There is no doubt that the COVID-19 pandemic has changed the way people now live their lives. There are now new normals that people are expected to live with. One of such is the compulsory use of face masks, especially in public places. We decided to engage some students who are writing the senior school certificate examination and the basic education certificate examinations on what they think about the use of face masks. Some of them say it's not convenient for them, while others say that they are forced to live by it because they must protect themselves.
I'm in SS3, and during the examination, wearing the face mask is not that muchly convenient for me because the breathing of oxygen is not that free.
It's really difficult because it's hard for us to breathe. And so, though it's been advised that we should always be like removing the mask from time to time so that we can be able to breathe well. Well, the other protocols are okay. At least it's all for the safety of us.
So what do health experts think about the use of face masks?
Studies have shown that if, for instance, I put on my face mask regularly and others also put on theirs regularly, there's virtually almost like 100% surety that this disease will not be transmitted.
Niger State is currently battling to contain the spread of COVID-19, having recorded 237 confirmed positive cases with 12 deaths. In spite of the complaints, the use of face masks in the state still remains in force. Emperor Simon for COVID-19 updates.
Dr. Tony Adeyemi is a public health physician and she joins us here in Lagos. Thank you for joining us on the program.
Good morning. Thank you for having me.
Okay, so it's tricky looking at that report from Niger, students saying it's a little difficult, wearing the face mask. What are your thoughts, with regards to that?
I mean, I feel their pain because actually as a face mask user as well, and also a medical professional, where we have even been using face masks even before the advent of COVID-19, especially when we're in theater and you have long surgery hours, you wear this face mask for prolonged hours. But the only slight difference is that if you notice, if you're in like an air-conditioned environment, it's actually easier to breathe with the face mask than when you're out in the hot sun or in a very humid environment. So I actually feel for them. Although reports, we've been having conflicting reports saying that some people are complaining of dizziness, saying that sometimes they faint when they wear the face mask and all that it causes. There's actually a medical condition called hypercapnia, which is accumulation of carbon dioxide. Carbon dioxide is what you breathe out. So you take in oxygen and you breathe out carbon dioxide. However, this does not happen when you wear the regular face mask. This happens, it's an extreme condition, and you need to inhale high doses and high levels of carbon dioxide before it can tip you to a state of hypercapnia. So we are not scared that this would happen with face mask users. So it's not regular face mask users. And for face mask use, there are different things that can actually make it have an adverse effect on you. If you have a predisposing health condition, for example, if you're asthmatic or you have any other lung condition that you might not be aware of, the kind of material of face mask that you're actually using, your face mask should be breathable. Then the duration of hours, how long you wear your face mask for. General guidelines states that wear face mask when you're going out, when you're going to public places, when you're going to areas that are highly congested, you wear your face mask. But what if you get to your office and you're physically distanced from the next person? You can actually remove your face mask because you're sure that whatever droplets coming out from your mouth or your nose cannot get to the next person as long as you're 6 meters away. So for these students writing exams, I think their longest duration of paper should be like between 2 hours to 3 hours. So it's a good time. They can actually keep their face mask on, provided they have the right kind of face mask and it's breathable. I heard from the reports that it's actually the schools that are providing this face mask for them. So obviously for them to do that, I believe they would have contacted the right authorities to let them know the guidelines on face masks to be used, what kind of materials to use. So you don't have different students coming up with different kind of materials that will make them uncomfortable. And with this face mask that the school is probably providing for them, I believe they are the breathable ones and they are the type that they can use for 2 to 3 hours while they write their papers to ensure that they do not accumulate carbon dioxide.
Do you think that in any way inhibits learning? If their minds are off, what they're supposed to be doing, the answers they're supposed to be giving? Because the UK government said that face masks shouldn't be necessarily worn in classrooms in the UK, but maybe on corridors. So you think perhaps maybe the NCDC needs to adjust this guideline? Do we have a face mask covering guideline for schools, especially when, they resume in full?
Okay, to the best of my knowledge, for now, I don't think we have any specific guidelines stating what students, where they should wear it and all. The general guideline is wear your face mask. It's a compulsory face mask use. But we can also adopt from other countries where they wear the face mask only in crowded and crowded spaces, joint spaces, maybe like hallways where everybody congregates, or assembly grounds or something. They wear their face mask. But then remember that face mask is not the only measure against COVID-19. So other things have to be put in place. Very important is physical distancing. If you can put all those and cleaning surfaces regularly. So if you can ensure like maybe your classroom is properly situated and the student A is, there's a good enough distance between student A and student B, then of course you can actually review that. It will now depend on the individual schools that have been able to put the other measures in place that can now decide that, oh, okay, because our students are not so close to each other, we have sanitizers everywhere, they can actually do without their face mask. As regards inhibiting learning, remember that face mask itself is a new normal. It's a distraction. It's something these children are not used to. There are some children that have panic attacks. They have phobias. They have all sorts of things. If you leave a child in like maybe a room alone, the child can be claustrophobic. So face masks can also give that kind of effect. So if the child is concentrating on something other than what the teacher is telling because he has maybe underlying panic attacks or so, of course it's going to inhibit learning.
So we have certain local government areas that the Presidential Task Force has talked about with higher numbers of COVID-19. So in those places where we have schools, what sort of measures should be taken there? Should they be different from perhaps local government areas that don't have as much cases?
Yeah, so that's another area now that has to do with, if we're still talking about face masks, that has to do with the regulations so you don't just give a general blanket guideline, maybe for like the whole nation or something. You need to consider the level of transmission, how high it is in that area. So if you're still having a very high community transmission, what that means is anybody could be having COVID and you might not know. You would have a lot of asymptomatic cases. So in that area in particular, it is mandatory. It is important that everybody uses a face mask because you have a high level of transmission. But you could have another local government where you're having very few cases and you're able to put all the other measures. Remember, I keep emphasizing that face mask is not only the measure against COVID-19. Then you can actually review your guidelines and adapt it to your own particular local governments.
So the NCDC talked about more measures such as before leaving home, wash your hands on arrival at schools, wash your hands as well. If you're after break sporting activities, you're also required to wash your hands, before eating food or snack, washing your hands as well. With all of the measures and what, governments across the world are doing, in terms of children perhaps in primary schools, is there a requirement, an age requirement to wear face masks? Because I know they've said below 2 years.
Okay, WHO has actually reviewed that below 2 years. So for now, WHO, what they have come up with is below 5 might not be required to wear face mask. But then they are also including the fact that you need to consider the individual situation of that child. So if the child lives with vulnerable ones, is it because you don't want the child getting COVID and taking it home to the vulnerables at home? So you need to also consider that. But generally, from age 12 and above, it's mandatory. The guidelines for adults also relates with them, so they are supposed to use face masks. Between 6 and 11, you consider the environment, you consider the level of transmission in that community, you consider their unique situation, who they live with, caregivers and all. But below 5, WHO has said that they do not require to wear face masks for now. It keeps changing.
All right, we appreciate your time. Thank you so much, Dr. Tony Adeyemi, a public health physician.
Thank you for having me.
Thank you for joining us. We have more on the COVID-19 updates when we return. Please stay with us. Welcome back to the program. Now, the Minister of Aviation announced that the resumption of international flights will begin from the 29th of August 2020, starting with Lagos and Abuja, just as the domestic flight resumption. So it's just about a few days to the resumption. Joining us right now via Skype is the Director General, Nigeria Civil Aviation Authority, NCAA, Captain Musa Nuhu. He joins us via Skype. Thank you for joining us on the program.
Good morning. Thank you very much for having me here.
All right. Pray tell, how ready is the country to open its airspace to international flights?
Okay, I'll say we're almost there. Most of the logistics have been put in place. We just have a few details as regards to the issue of COVID testing. That should be finalized very soon, and we should be ready on time to start on the 29th, which I believe is Saturday, in about 2 or 3 days' time.
The presidential task force mentioned things like ensuring pre-boarding protocols 2 weeks before departure, no less than 5 days pre-boarding preferably. How do you guarantee the validity of the pre-boarding PCR tests?
Okay, to start with, it's no longer 2 weeks before departure. The new protocols require for testing 48 to 72 hours before departure for Nigeria, and with a maximum validity of 1 week. And the guarantee of the pre-boarding COVID test is one of the logistics that have been worked out to ensure that those who present their COVID results before being allowed on flights into Nigeria present genuine results. So that's one of the remaining logistics being worked out.
So was there a reason for this particular review? Does that mean that the coast is clear, especially, and also in light of what you talked about, the reciprocity rule? I mean, how does this apply to some of the countries coming in?
Well, the reciprocity rules principle is just some different countries have different restrictions. Some is just general restrictions for all passengers going into that country, and some they have mentioned specific countries that they put some kind of restrictions on them. So the reciprocity depends on what the country does. If we say that Nigerian citizens cannot come to your country, then your citizens cannot come to Nigeria, and so on and so forth.
In terms of quarantine, is there a time frame for those coming in?
Okay, what is being worked on now? You have a COVID test, preferably between 48 and 72 hours before you depart for Nigeria, and that's an online platform that is being worked out. You go fill all the necessary details that the health authorities did, and you pay for the test you're going to take in Nigeria. So what happens, you come into Nigeria, when you pay for the test, you're given a receipt. You print a receipt with a barcode. You come to Nigeria, the authorities at the airport check, then you go into the town, then a week after your arrival, you are expected to go have another test to ensure that you are free of COVID-19. And depending on the results, if you are negative, you are free to go. And if you are sick with symptoms, you will be required to go into quarantine.
So within that 1 week, you're expected to self-isolate?
That's the whole idea, yes.
Tell us about, because FAN has said that no one should give money to anyone at the airport for COVID-19 clearance. So, I mean, who is expected to be at the airport to interface with passengers? And, if there are people that are offering such service, what's the reports mechanism?
That's nothing like COVID-19 clearance at the airport, because you've already done your tests before you come to Nigeria, and you've already paid for the second test to come into Nigeria. So all the authorities at the airport is to confirm, first of all, you have a COVID test, a negative COVID test to be allowed into Nigeria. And then number two, you have paid for the second COVID test that you'll take 7 days later. So there's nothing really like giving COVID clearance at the airport. And don't forget, the airport, you have a lot of security agencies. You have the customs, immigration, state security, airport security. So there are a lot of agencies in the airport that work there to ensure that all this is done through. And immigration also is very critical. And you have the port health authorities that will be checking this COVID results.
Finally, before we let you go, on contact tracing, has everything now been digitized, or is there a particular card information that you also have to fill?
Well, yes, I mentioned there's an online platform that will be released in a day or two. So before you depart, you go on that online platform and fill all your travel history, your contact information, every other thing that the authorities need to know. And it's the same online platform that you use to pay for the second COVID test you'll be taking in Nigeria.
So essentially, there won't be any paper that you'll be required to fill information as used to be the case before COVID.
That is the whole idea, to prevent the paper form filling, which creates unnecessary crowding and destabilizes the facilitation. So the whole idea is, before you come in, you've filled all the necessary information, and you pay for the COVID test, and you print, you are given a receipt, and with the barcode. So that barcode is what we use to scan to show all your information that you feel if there's need for contact tracing for any particular passenger or group of passengers.
Indeed, it will also help, especially if you have a bad handwriting as well. Well, we'd like to thank you so much. The Director, DG, Nigeria Civil Aviation Authority, Captain Musa Nuhu, thank you for joining us on the program.
Thank you very much. Have a great day.
You as well. Now, over in Spain, it says it is going to enlist the help of the army to identify people who have been exposed to the coronavirus. Prime Minister Pedro Sanchez said about 2,000 soldiers who are trained in tracking are going to be sent to the region. Some experts have blamed a lack of virus trackers for a surge in cases in parts including Madrid and Catalonia. The country has more than 400,000 confirmed cases of the virus, the highest in Western Europe.
Although France has been facing an increase in its coronavirus count in recent weeks, a French epidemiologist said the rise in hospitalization for COVID-19 remains under control. France has seen in recent weeks a jump in the number of new infections, with a post-lockdown 24-hour record of nearly 5,000 on Sunday. South Korea has ordered doctors in the Seoul area to return to work as they begin a 3-day strike in protest of several government proposals, including one to boost the number of doctors to deal with health crises like the COVID-19 virus. Trainee doctors have been staging ongoing walkouts, and thousands of additional doctors were due to stage a 3-day strike starting on Wednesday. A North Korean leader, Kim Jong-un, has called for prevention efforts against the coronavirus and a typhoon that's looming in the nation. An enlarged meeting of the Politburo of the Workers' Party took place on Tuesday amid a pandemic that is putting additional pressure on the North Korean economy, battered by recent border closures and flood damages. State-run television KRT on Wednesday showed Kim in a white shirt, not wearing a face mask, presiding over the meeting, laughing with officials and raising his hand to approve measures discussed. And Chile has passed the somber milestone of 400,000 coronavirus cases in the country as the South American nation gradually eases out of lockdown. As of Tuesday, Chile registered some 401,000 cases and 10,958 deaths. Outside of Santiago and its metropolitan area, residents have seen some of the stiffest lockdown restrictions lifted, but the capital still keeps some measures in place.
For more updates, you can take a closer look at our website. It has the latest updates on the pandemic. All you need to do is log on. It's channelstv.com. Access news in health, politics, business, sports, and they're also coming from Africa and around the world. It's all at your fingertips. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.